Hello, we are members of the Racine County Youth and Governance Program, and we will be participating in tonight's meeting. This program serves to empower youth in Racine County by encouraging us to participate in local government. We have agreed to abide by the applicable standards of conduct that would govern any elected county board member. While we are encouraged to participate and are allowed to have a non-binding advisory vote on matters before the committee, all formal action taken by this committee will be based solely on the binding votes made by county board supervisors. Thank you.
Thank you very much. And at the moment, we have a quorum for the committee, but not the board. So I'm going to skip down to item 6, which is the report by the county executive making an appointment to the Racine County Human Services Board. That appointee is Gabrielle Hood, Racine police officer who has wonderful experience in a variety of areas. And so it would be up to the committee to make a recommendation to the full county board. So the full county board can act tomorrow night. What is the pleasure of the committee?
Move to approve, Chairman.
We have a motion to approve Gabrielle Hood as a member of the Human Services Board. Is there a second?
Second.
We have a motion and a second. Any discussion? Okay, then we can have a vote. Youth and governance, all in favor?
Aye.
County supervisors, all in favor?
Aye.
Are there any opposed? That report is approved and I will so share with the county board tomorrow evening. We also, just a little preview, apparently there is another nominee for the Human Services Board, and I think I will ask the committee members to consider that tomorrow night during the county board meeting, so it doesn't have to wait until May, and we can get the Human Services Board up to full staffing. So that's just a preview for my fellow committee members. All right, please remind me that we have to go back to our other agenda items as soon as the Human Services Board has its quorum. But, and I assume that I forgot to call out, shout out for our veteran in our midst. It's always important because that's one of our areas. So thank you for your service. Thank you for being here tonight, Pastor Hargrove. And I see no other members of the public, so there were no members for the public. That moves us up to item 7, which is the COC memorandum review. And I think Hope wants to start us off on that.
Okay, there we go. And at the request of the Human Services Board and Committee, we prepared a memo to be disseminated out to the full county board and went through Chairman Kramer and then ultimately Wendy Christensen to submit this. But I wanted to bring it to the group as well, just to see if there was any questions. Hopefully this provides a little bit more clarity about, I guess, what responsibilities we're really looking to take on in terms of the continuum of care for housing insecurity. And it is, in fact, more of a administrative agent for filtering funds for the region and helping to determine the actual service providers in the space, their allocations. And additionally, it positions us well for additional grants. Michaela is here because she's served as a big point of contact in terms of digging into a little bit more about what the existing COC arrangement looks like and how we will help to transition. So I'm here to answer any questions related to the memo, timeline, things like that, and Michaela to answer any questions regarding the COC.
I still had in my head that, this is not the final step.
That's correct.
Cause I think there was a little confusion in my mind and maybe everybody else's about how this unfolds.
Yeah. So part of this is because of the delay in the release of HUD funding that we wanted to be able to have this all in place prior to submitting this year's collaborative application. Because there's been a delay with this, we wanted to not rush through and not have enough time for our team to be able to learn the process. So we are going to wait until that is submitted and have the existing group submit the application. And then moving forward, we would then know what the funding is for us and be able to give a clear guideline to you with what that award amount. And until then, it would feel too, I guess, uncertain about what that all entails. So that's what the delay is. It's really related to the federal HUD delay.
Thank you. Are there any other questions on the memo before we go to the next step of this presentation? Supervisor Rossi?
Thank you, Chairman. So procedurally then, if this is not the final step, what is the next step? Is it a resolution?
Yeah, so the intent to enter into an MOU is basically to demonstrate support because there's a little bit of uncertainty, I guess, in the community of what our role is and when, and just what the board's pleasure is for this. So this is to give time until the actual funding is released to answer questions, learn more about the process. So the initial is, it's weird, but it's intent to enter into an MOU. And then in May, we will be moving forward with the actual steps with the fiscal note, the position, likely position add and or allocation of who would be fulfilling that function and how it would be fully funded.
Thank you.
Mhm.
The next question would be then, we brought this up the last meeting, the county's involvement, I believe it's excuse me, I'm rushing to get to this meeting and I was reading through the minutes right before I came here. And, are we comfortable then with, just the two positions? I believe it was two positions on the board.
Mhm.
Do we want to have more?
I do. I would. I mean, I think part of it is again, the actual COC board is independent of our role, and there are rules about who needs to be part of that COC board, and it is actual service providers, impacted community members. Like there's things independent of this, but in order to effectuate change, and that's part of why we're taking the time to like really flesh this out, I do think having more county involvement is not a bad thing. So,
And thank you for that. And to that point, I don't see why the county in our appointment process or the executive's appointment process, our confirmation, couldn't find someone to fulfill those obligations. And I'm aware of those. There are,
sure.
there's certain qualifiers. It appears to me that about half of the board has to meet certain, is it HUD requirements?
Yeah. Yeah. I think it is HUD that's dictating the way that COCs need to be established.
So with that, Chairman, I'd like to at least go to three positions on the current board, whether that be they add an additional position, so increasing the board members, one more from what's proposed, or if one of the existing positions then upon, retirement or removal from the board, then gets filled with a county position.
Yeah, I mean, I think it's a great idea. I just don't know if the feds let us do. This reminds me of Community Action Agency, which is somewhat independent, yet we have members on it, but there are all kinds, there are
Parks
all
like that
kinds
too.
of criteria that the federal government demands for that agency as well.
Mhm.
So,
Yep.
but to Supervisor Rossi's point, would this be possible for us to add another?
I don't, my instinct is it is possible. What I would be getting nervous about is if there's like a ratio issue, if that would just be then the counter is to add more members from the larger community in the negotiations. But this is something I'd absolutely bring to Corporation Council to talk with Bob about and see whether or not, that's a point for them. But I think it's a very reasonable request and we'll just figure out whether or not it's permissible, yeah. To make that.
Questions on the memo? All right, then let's move ahead. Michaela is going to enlighten us, and we appreciate that you're here tonight. Again, because we're broadcasting, please use the mic.
So the memo just outlines the proposed MOU where Racine County serves as the collaborative applicant for the Continuum of Care, or COC. The county would lead strategic planning and submit the annual HUD funding application, helping bring federal dollars into the community to address homelessness. Something that is important to note within the memo is that the county would not be operating the programs directly, but rather coordinating efforts across partners and managing the funding process. The goal is to strengthen collaboration, maximize available funding, and reduce strain on county systems such as emergency services and the jail. The MOU also includes a dedicated coordinator position, county representation on the COC board, and funding to help offset these responsibilities. So that's a little bit about what the memo included. Any other info?
And I think one of the things, just because there's so much that we cover in the meetings and a lot of various points, typically the funding that's coming through HUD can vary, but not for this collaborative applicant piece. That part is never seemed to be in jeopardy over time. And the amount is more than sufficient to cover a full-time equivalent and potentially the administrative functions supported with that. So during this time, as we work through the transition, with both Michaela and Kristen Lattis and myself, we will be looking at what all entails the actual application, and then what role of facilitation and maybe going a little bit above and beyond what typically has been done through the coordinator function to be able to improve just overall like system level concerns for homelessness, entry points, coordinated entry, things like that.
And one of the positives I see is the potential with our dedicated and knowledgeable staff that you may be aware of more federal money than some who are not in this every day would be
Right.
aware. Yeah.
Thank you.
Supervisor Meyer.
It might be loading.
Okay, thank you. Michaela, maybe you know the answer to this or maybe not. I've been doing some research with Director Otto in regards to the population of homelessness in Racine County right now, and it's averaging between 150 on the eastern side and like 50 or so on the western side. Has that been kind of a consistent number, would you know, or maybe you haven't dived that much into those numbers with the research for the continuation of care? But have you, or maybe Director Otto or Steve or somebody may know as far as, is that kind of a consistent number? Is it a elevated number? Is it a, declining number? I mean, it's always hard to tell, get a real snapshot on how many we have because of basically, with our shelters and stuff that are more times than not, full capacity. But just kind of curious, is there's a trending, are we up, we down, are we kind of in the middle? If that kind of sheds a little light on this, because this kind of helps with this continuation of care. It kind of helps streamline some of our efforts and some of our funding to help make sure that those dollars are going to the right places too. So I don't know if you can speak to that or at least have an idea if we're kind of at an average.
I think that is such a great question. And Supervisor Rossi's question about the notices and current data, I think is one of the areas that we can see a possible process improvement because the transparency of the information, it takes a lot to be able to find some of this. And so I'm really impressed by being able to come up with that information that's 100% accurate of around 200. I would say that the numbers are going to change based on potentially admission policies of the shelters, as well as other pressures, like potentially like during COVID, those numbers might have been deflated in terms of the actual shelter operations because they were not being able to, accommodate the same volume. And those numbers are taking into account both shelter and street outreach. And so probably ebb and flow from, I would say on the low end, maybe 150, 170 to 230, 250 on the higher end. But it hasn't really drastically changed. The other part is when the parameters for admission criteria change with the shelter, which different leadership has, there may or may not be more regional access into that shelter. So some of those numbers might be a little off based on that. One of the things we're hoping to do is just work closer with the agency that monitors all of the data tracking for the COC. Do you remember their name? Orida's organization? That's okay. I think it's ICA. I think that's the name of them. But in any event, they hold the contract for the entire state for data tracking. And I think it's a matter of the COC working in more collaboration of pulling data that's meaningful for helping to gauge the true point in time counts.
So as a follow-up to Supervisor Meyer's question, doesn't the Hope Center do some kind of an informal
Yep.
census once or twice a year?
Yep. The last one was in January. We don't have the results of that yet, I don't believe. But that's the point in time street outreach, and they have volunteers that go out to gauge how many individuals are completely in-house and not in shelter operations. And they use that into the formula.
And thank you. Just to follow up that too, and I'm sure with seasonal changes is harder to track as well, just from just onset it's warmer, people are, and some of them, the data that they collect, does that actually track if they're local residents or if they're transients?
That is a really, really good question. And right now, we do not have any good information on that.
Other question? So this is actually before the county board tomorrow. Right?
For first reading or second reading?
Second.
Okay, thank you. All right, thank you.
Because tomorrow's the end of the county board.
That's right. Okay,
If someone could be present
Yep.
tomorrow night, that would be
Absolutely.
very helpful.
you got it.
All right. Well, let's go back now that we have a quorum for both bodies to item 4. And this would be for the Human Services Board only, since there was not a quorum at the last meeting. They're asked to take action on the February 23rd minutes. So what is the pleasure of the Human Services Board?
Second.
There's a motion and a second from the Human Services Board to approve the February 23rd minutes. Is there any discussion? All in favor? Any opposed? That is approved. Then we had a joint meeting on March 23rd, and there were minutes in your packet. I would entertain a motion for both bodies, either Scott or Supervisor Shakur. Okay, so we have a motion and a second from representatives who are actually members of both bodies to approve the March 23rd minutes. Is there any discussion? All right, I'll ask the Human Services Board first. All in favor? Any opposed? And then for the committee, Youth and Governance, all in favor? County Supervisors, all in favor? Any opposed? Those are also approved. All right, moving on to item 8, Wellness Connect Vision and Implementation Plan. And we have Steve Bedwell and Yelena Jones here.
Mhm.
Jones?
Mhm. I like that. Yelena Jones.
Sounds like
Okay.
a Hollywood star.
Yeah, I agree. So I'll just say a few brief remarks before I hand it over to Yelena to talk a little bit more in detail about Wellness Connect. But just wanted to talk about the vision of this. And this started, I would say, at least 3 or 4 years ago when we were having conversations about the, increased awareness regarding mental health in our community and just the lack of providers. And just what the private sector isn't able to make up for and what role we have in that space, right? And part of it is billing challenges, part of it is being able to recruit licensed professionals. And so we started the assessment center as a way to bring a simplified way for people to have walk-in services. So there are, I believe, 80 hours of walk-in crisis. And that helped to then serve as kind of a triage point into our existing programs, community providers, or sometimes that one visit was all that individuals need. So looking forward and just like, how can we take the successes of that and know that there's still broader demand than what we're doing? We weren't overly advertising the program, partially because of capacity challenges. But this amazing team sat down together to talk about how does this look just even for the people we're already serving, and how do we do a better job to bill for existing services? Because when you are going into a licensed professional, as opposed to in an area where we're providing services without billing, we aren't able to capture necessarily all of those expenses that we would be otherwise just absorbing. So that's a high level explanation, but they will get in a lot more detail about what a true partnership look like between the youth and family division and behavioral health to serve people in a broader capacity, and then also able to do so at a reduced cost. So with that, I'll turn it over to Yelena.
All right, so when Steve and I first began discussing, when Steve and I first started discussing and looking at the assessment center, which is now Wellness Connect, we wanted to really figure out how our services, if there was any duplicative services or anything that kind of cross paths where we could bring the services together and provide a better service. So one of those were the CST and Boost integration. With that, obviously we began to look and explore of how can we better serve the public. So this was our basically for Wellness Connect, we were trying to accomplish a centralized entry point for any type of mental health services here in Racine County. And as Hope mentioned, the one thing that we struggled with was the waiting times for mental health services within Racine County. And individuals that contact us normally say that they're waiting, 2 months to get into services. So we really wanted to make sure that individuals have somewhere to turn in the moment that they need the service. So when an individual contacts Wellness Connect, they may do it by phone, they may come in, walk in and ask for services. They're able to meet with someone in that present moment and really figure out what's going on, what are they actually looking for. Oftentimes when individuals come to Wellness Connect, they don't know what they're really seeking. They just know that they're in a troubling time in their life. So what we really tried, Steve and I worked very closely in trying to make sure that and Michaela helped a lot with this as well, is making sure that any type of advertising that we had regarding Wellness Connect really drove that bullet point home to make sure that individuals are aware no matter what your crisis is in this given moment, you're able to access services here. Sometimes that may be a call because somebody lost their job and they don't know where to turn next and it's pushing them into a crisis. Other times somebody may be going through their first psychiatric break. And at other times they may be looking for substance use disorder treatment services. So really Wellness Connect is a place where individual contacts us, they come in, complete an assessment, we identify what their needs are. If there's any referral sources that we don't provide or anything else that they're seeking, we're linking them to those services. And then really it's us making sure that we're doing those follow-up services for individuals. Sometimes we all know from being human that if you're in an overwhelmed portion of your life, sometimes you need that additional push. And that's exactly what these Wellness Connect workers are doing, is making sure that the individual's needs are being met. So we try to provide as much resource navigation, education that we can provide in this, and just making sure that we're providing all the services that they need in like a one-stop shop. And if we don't provide it directly, then obviously linking them to the appropriate services. So our messaging is no matter what you call us for, we will find, the resource that you're looking for. So that's really helpful. We wanted to provide some early outcome data from the beginning of this year through the month of March. So far, 135 individuals have been served, a total of 141 contacts. So that means that most individuals may get their needs met within one time or at least linked to the service that they're looking for. We've had a 12% increase in contacts compared to Assessment Center during that same time period. So that's a positive in getting the Wellness Connect messaging out to the community. We've also ago, and I am very happy about this, 33 referrals to CCS were generated through Wellness Connect. The one thing that we really try to do is make the school systems aware of how to access services and make sure that we're not creating a barrier into them making referrals to behavioral health services so that they're coming through Wellness Connect. And we're really trying to help people navigate that path. We are planning, obviously, with the new building coming, we'll do a grander launch. It's always nice to know that when they walk into that building, that's the first, they'll see the reception area, but they can come in at any time and meet with Wellness Connect workers there. The other data points that we were really interested in reviewing was the amount of individuals that were served through Wellness Connect. What further linkage or intervention did they require through crisis? And I'm happy to say 0 of them went on for further psychiatric hospitalizations, and then less than 1% required additional mobile crisis intervention. So I think that's phenomenal for the number of folks that we were able to see at Wellness Connect.
I will just give a little bit of acronym assistance and then ask Steve to talk a little bit about the CST and boost aspect of it because it's independent of Wellness Connect, but it was part of the net change that we presented to this group when we talked about the overall restructuring of individuals that used to sit in the youth and family division that moved over to the behavioral health area and kind of the why behind it. But the reason, if you look on the referrals to CCS and why that's an important metric for us, is the state doesn't always give us funds in a way that is equal in reimbursement. And so certain programs have a higher reimbursement rate and also an intent to serve a broader population. CCS is our largest case management program, and we can service both kids and adults in the program. And there's a lot of overlap within the school district, like Yelena was talking about. So that's an area where if we grow professionals in there, we have a literally by design, it's 100% reimbursable for all the services rendered in that area. So we want to direct people to that, not only because it provides all of the like holistic supports people need. They call it, it's a little jargony, but psychosocial rehab. And so it's really just looking at all of the psychological and social factors that lead to the health of a child or an adult. And it's fully funded. So we want to maximize that resource if it's appropriate. So being able to use that triage point and help navigate through that it's really a win-win for the community there. And then Steve, if you want to talk briefly about like Boost, what that program is, and CST, because we actually just had this conversation today. We're going to choose to probably use Boost synonymous with this because the other is just internal stuff for us, but go ahead.
Sure. So, gosh, I don't remember how many years ago it was, but several years ago in the Youth and Family Division, we created the Boost program, which was a voluntary program to service families who were in need. And so it was to keep them outside of the court system, outside of the child welfare system, outside of the youth justice system, to be able to provide them services before the true crisis occurred. For a long time now, Behavioral Health Services has run the program, the CST program, Coordinated Service Team Approach program. And the two programs are quite similar. So a lot of our integration here was focused on really how do we make these two programs work together to provide those services. And really what Yelena talked about and Hope has talked about here today are, I guess I'd raise as 3 things. So what Wellness Connect does is it provides simplification, it provides integration with a little cost containment on top. And historically, any of these services at the Human Services Department can be difficult to navigate. So if you come in, maybe you have a child who's struggling or there's some sort of traumatic situation has happened in your life, and you reach out to the Human Services Department, or you just even go to the website and try to figure out what services are available for me. What do I qualify for? You come across all kinds of acronyms of programs from CCS to CST, and now you notice there's a Boost program, and then there's substance abuse programs, and then there's all these types of programs. And so it was kind of on you to figure out maybe where do I best call? What am I saying I need? What this really does is really simplify it down to you make one call and we'll guide you the rest of the way. So you place that call and we're going to figure out what do you qualify for? you know, if you have Medicaid, this is what you qualify for. And it expedites that enrollment into that program and gets you started. So instead of somebody needing to figure that out on their own, we're prepared to figure that out for you, with you, and make decisions alongside you to where you're going to be able to best fit into one of the programs that the Human Services Department has to offer.
Well, this is, this is just, a wonderful development in our longtime culture of trying to get everybody to work together on the mission of the whole department. And I'm not saying I'm not gonna say what I'm gonna say because I don't want money to go to human services. But you can see once again how we get the most out of every dollar that is appropriated. And I mean, the initial data here shows that this is a fantastic success. So bravo to all of you for continuing to work as a big team for all of these issues. And I think there's no doubt that the public is being better served by this. Questions or comments? Supervisor Meyer.
Thank you, Chairman. Steve, would you just remind the listeners about the acronyms that we were just kind of tossing around here, CCS and CST?
Sure, I can do that quickly. Comprehensive Community Services. So again, that's the case management program for psychosocial supports and everything from employment to, you know, treatment for mental health conditions to substance abuse, you know, helping to navigate additional resources. And we have about, what, 400 people in the program? 300. So it's by far our largest program. CSP, you heard us talk about a little before. We have about 60 people in that program. Okay, and that's similar to that, but it's focused a little bit more on individuals with more serious and persistent mental illness. It's more of a legacy program. So we didn't talk about that, just, but if it comes back up. And then CST is typically more of a teaming program. Is this when Medicaid is not a billable service? And so that's available for when somebody doesn't fall into an existing program. And so that aligns very well with Boost. And Boost is the voluntary program out of the youth and family area.
And thank you for that, just because especially in this committee, we use so many acronyms.
I know.
And most of us, you know, sometimes just it's repetitive over and over and over, but the public that's listening may not know, and or even some of the youth may not know too, because sometimes we don't use them enough. And it's always just good to recap for what it is. But
It's how I feel on the building calls. When we sit on the building calls, I'm like, I do not know these words.
Thank you, Supervisor Meyer. Other comments, questions? Supervisor Rossi.
Thank you, Chairman. Just a question, with these programs, any of the crisis response programs, is there a situation where, you know, someone calls in for 911 and maybe it's redirected to the crisis response team?
All the time. Mm-hmm.
Excellent. Thank you.
And you know, it's a good presentation when there aren't a lot of questions.
Well, thank you. I would also just mention one of the things we didn't highlight here is just the longer launch. We were larger launch, but it is longer too. We're going to put it out further. And part of it is because while this service exists in the new facility, it's going to be easier to staff. It's just our current arrangement for those who have toured Dominic is a little limited. Right now, also, the program is operated at our clinic space, and it's just harder to be able to provide, you know, the confidential triaging and getting people connected. So the new environment will allow us to do that so much better. So we'll push out a broader public launch with the new building.
Yeah, I think it's very exciting that as we anticipate the new building, that this is just going to get a real big boost. You know, so it's great. Thank you so much. Next on our agenda is Meals on Wheels update, and Yelena has that as well.
So we just want to provide an update regarding the Greater Wisconsin Agency on Aging, GWAR. We had a gift opportunity, a grant opportunity, excuse me, that would be nice, which they are calling it the Major Gift Grant. This is meant to fund the home delivered meals. Obviously, they know that different counties are experiencing some issues with, wait lists or delayed enrollment in the program. We obviously have prioritized now for some time. At the beginning of this year, January 1st, we also began the delayed enrollment, which obviously normally the delay is 1 to 2 weeks, so that still has held steady. We are happy to let everyone know that we were awarded $100,000 by GWAR to support the individuals currently in a delay for Meals on Wheels. We're obviously appreciative of this funds and we wanted to share that. The one additional thing, and I'll share it here, obviously our request was a little bit larger. The max gift that they allow is $100,000. We are still, obviously, we're early on in the year, still looking at the budget and how things progress throughout the year, but there is an opportunity later in the year if additional funds are needed that we could potentially ask for more funds. So we'll leave that there and hopefully we're down the right track.
Very good news, and I just appreciate that. You anticipated this, you took proactive measures, and now we're in pretty good shape. So thank you.
One thing I want to highlight with that too is not, one of the urges that we often have is trying to fix the problem immediately when it happens. And this positioned ourselves actually better by pausing and waiting to be able to demonstrate the gap that we had, because then we were able to be eligible for the largest amount for the state allocation. If we didn't have that, we wouldn't have been able to receive the maximum part. So part of this is just strategy and it can be very frustrating. But I think it served us well in this scenario.
I think to that exact point, the one thing that I forgot to mention, the grant eligibility, if there was any county dollars like levy in the program, you weren't eligible for the grant. So we found that rather interesting for other counties that experienced some of that.
That's just awesome news. All right, thank you. Any questions? All right, we will go to item 10, our opioid and overdose update.
So, Yelena, if you just want to talk a little bit, if to put you on the spot, but on the front side, I just saw there were some changes in terms of like partnership with the city of Racine. So talking, the front page of this is on the BHS or distribution training end, and as on the back is a refresher, which is pretty intuitive, but is the public health actual vending machines, and then it's how they kind of partner together. So this is about supply and the other is about demand, really. So on the supply end, would you like to talk a little bit about partnerships there? Thanks.
So I think we obviously continue to work with the local law enforcement municipalities. Most EMS and law enforcement municipalities have applied for their own grant because there is eligibility there. We have obviously always worked closely with the school systems and making sure that they have the nalox boxes, the Narcan refills whenever they need it. I think we've done a phenomenal level of community outreach where individuals know where to reach out if they are looking for Narcan or different trainings, the fentanyl test strips or the xylazine test strips. Most recently, obviously, with the opioid awareness day, which when we get closer, Supervisor Coleman, from last year, we remember this, we're going to do a lot more outreach to just kind of get more, I don't want to say media, but more
Public awareness.
public awareness, there you go, regarding the event, but we worked very closely, and we've done this for a number of years, obviously with our health department, the city health department. We've worked with the surrounding providers for substance use. Sometimes it's the methadone clinic, which obviously through one of the grants that we received, we're able to get individuals that need the methadone treatment funded at RCTC, Racine County Treatment Center. There we go with the acronyms. And then as far as any local hospitals here, we invited them all. good handful of them showed up. I was proud to say that we had enough individuals there from community partners that it really set the table of individuals being able to kind of walk around and figure out what service they were looking for. So we continue to work on the community partnerships. Most recently, the city health department needed some additional fentanyl test strips. That's something that obviously the fentanyl test strips, the xylazine test strips, and the Narcan, we are able to get obtained from a grant. So we are more than willing to give them out to the community where they're necessary. We were able to give 2,000 fentanyl test strips to the city of Racine for their vending machines as well. And we still have an abundance, so I will say that.
Thank you. Questions?
If it's
Supervisor
open-
Shakur.
Oh, sorry.
Mr. Chairman, I don't have the mic, so I'm talking about like.
Okay.
Oh, yeah, that's right. I got one here.
Might need to start up. I'm serious.
Yeah. This one takes some time to warm up. Yeah, starting and all that other stuff. Thank you, Mr. Chairman. My question is probably a big one here, and I don't know if you can answer this or not, but just thinking about all these abuses, this opioid and overdoses. Is there anything that you can, in particular, point to what's causing all this in our county and the nation as far as that goes, probably the world? What is the focus? What's the problem? Why this is occurring? Or say, for example, my favorite, is it breakdown in the family? Is it, I mean, what's going on with this? Why we have these numbers are up here? And this seems to be,
So I think maybe the most helpful response is to this is that yes, to everything you said. The reasons that substance abuse exists, because that's really what we're talking about, is the drug of choice. And I just learned that on the back page, what I was going to say really quickly to cover the demand side is the numbers are declining, and we learned that part of it is that the drugs that are being requested now are more in the cocaine area. And we had somebody who served on the opioid task force, who's an addictionologist and actually works for us as well, Dr. Galdis Rage. Thank you. And I'm thinking he might be a good person to talk at some point to the committee to talk about all of the various reasons behind substance abuse disorder. It can be, I mean, just for very, very high level of this, it can be co-occurring with mental health. It can be because of previous family trauma. It could be just addiction running in the family. It can be, gateway drugs or individuals caught up in the wrong scenario. I mean, the list is really plentiful, but there's probably genetic and behavioral components and all that. But he speaks so beautifully to it, and has worked in the space as an addictionologist, one of the only ones I know in the region for 25 years, probably. So you got to see him in action. Like he's pretty amazing. So, yeah, and we also are looking to do a mental health summit in partnership with public health and law enforcement and behavioral health. So that's like a little preview. And he would be probably one of our guest speakers as well. But the answer to your question is yes to probably almost anything you're going to say of negative impacts to people's lives that it ends up leading to sometimes some sort of substance abuse. Am I missing anything, Yelena?
The only thing that I think about, and I always think about like the Netflix series when they talk about like the opioid epidemic. I mean, they are on point with the overprescribing of opioids and how that kind of led people down a rabbit hole. I think from any injury, individuals from all sides of life, and that's the main point that we try to drive home during our opioid awareness day in late August is really making people recognize that sometimes it's an injury at work and you get put on opioids. You don't know what the outcome of this is. Obviously, there's been more education now. I think the rules around that have been obviously tightened up to another level now to ensure that individuals are not receiving medication from multiple providers or they're not being overprescribed that. I think now when we think of even going to the dentist or the doctor's office, you can get a whole tooth pulled and they'll give you like 2 or 3 pain pills and that's all you're getting. And then you better transition to ibuprofen or whatever. So there's just a larger community awareness at this point in time.
Great, that's a good answer. The thing about situations like this, it's good to know as elected officials and things like that. So if within your community or the district that you represent, people ask questions, and sometimes you can tell them what they should do or what they could do. And because as we all know, it's a collaborative effort initiative. And the more information that we have, the better we can do what we need to do to address this crisis. Thank you.
Thank you, Supervisor. Any other comments or questions? All right. Moving on to correspondence and other business. Tonight is the last night for Neola Anderson to be our youth and governance rep. And I want to thank her for serving with us. We appreciate your participation, your questions, and your insights. And we hope it was beneficial to you.
I still don't know half the acronyms.
It's not your fault, it's mine. I do have another piece of update. Or do you have
I
another
just
one?
wanted to
Sorry.
add that our other youth and governance representative reapplied and was reappointed, and she has chosen to be with us for another term. So we will welcome the continued presence of Tria. And
And I just wanted to have a reminder for those who received the email about the county board tour for the behavioral health building. And I think it's next week or the week after for the county board, the 29th, I believe. I don't know what date it is, 2 weeks from now. Okay, thank you. Just a reminder for that, to put that on your calendars. It's really coming along. I would say we're about 3/4 of the way through the process.
yeah, if you go by now, it's really,
Yeah,
it's there.
it's there, exactly. Okay, great, thank you. And then
What was the time again?
I believe it's at 3 p.m.
3 p.m. Okay, thank you.
Sorry about that. And then the other update I have is just a huge, huge thank you to my team for some of the preliminary numbers have came in terms of our year end. And just given this is the last meeting for sure with the bodies that are sitting here today, the support that you've given me and our team, investing in the right areas and something that I'm hoping our ongoing dashboard is going to showcase a little bit more about the strategy behind what we're doing. But we closed the year end putting 3.2 million back in reserves this year.
Wow.
So we are extremely proud, and it's because of, I mean, these are the costly peeps right here. And they did such a great job with collaborating and focusing on keeping care in our community and doing family-based work versus, like, the disruption of that. So thank you. Thank you. Thank you, guys.
Well, we are certainly very proud of all the leadership in this room, but also the daily workers who are meeting with
Yep.
the people of our community all the time. So we are truly blessed.
Thank you.
Anyone else have any thing to announce?
I didn't want to announce anything. I just wanted to piggyback off of you because Neola was my mentee. And it was a pleasure as me being a mentor for the first time and having such a strong, strong young lady. She has a very great future ahead of her. And I just wish you the best of luck in everything that you do in your life. Make us proud.
Thank you, Supervisor. All right, the next meeting of the bodies will be May 11th. I don't know who will be on the committee, but will be determined by whomever is county board chair and vice chair. So a motion to adjourn, someone from both bodies. Supervisor Shakur with a second from Supervisor Meyer. All in favor? We are adjourned. Thank you all.